All right, next we have the founder of Health Wizz, Raj Sharma.
I'm Raj Sharma, and I'm the co-founder and CEO of Health Wizz. With here today is Shirish Bajpai, who's also a co-founder and CTO of Health Wizz. Between Shirish and I, we have several years of building distributed applications that are highly scalable, peer-to-peer distributed applications. And our third co-founder, Dr. Nitin Desai, who's our Chief Medical Officer, has several years of experience in healthcare and healthcare IT. Our medical records are scattered all over the place. Some of them are with hospitals, some of them are in clinics, labs, pharmacies, insurance companies, some of them are even on old-fashioned paper. And we are generating even more data with our wearables, as well as when we ask companies like 23andMe to sequence our genome. The problem is that today, you cannot turn to one place to get your health records. And that's not going to change anytime soon. Why am I so sure? Well, late last year, my mother had a fall, and she had to be admitted to the emergency room twice in 2 different hospitals. They couldn't find anything wrong with the first hospital. She had to be admitted again when she complained of pain. Both these hospitals in the same town, they were exchanging her records and her images using fax machines. And to make matters worse, one of the hospitals even repeated some of the tests that were done by the other hospitals because they were not readily accessible. We are going to change all this at Health Wizz. We are going to revolutionize your personal health records. And the way we are going to do that is by creating a highly personalized electronic health record system just for you, or an EHR of one. Now, we know this is a multi-billion-dollar problem, and probably an incredibly difficult problem to address. But there are 3 things that are happening that are very encouraging. 1, healthcare regulation. There are mandates from the government that say that all systems that are being used by hospitals and doctors must allow medical records to be accessible electronically by patients. Starting January 1st, 2018, as a user, if I'm using an app, then these hospitals and doctors' offices must allow my medical records to be accessible by my app. Second, healthcare standards. There is a new emerging standard called Fast Health Interoperability Resources, or FHIR. That promises, and it is being widely adopted, but it promises to make data interoperable and interchangeable amongst different systems. So to date, and number 3 is our team. We think we are very well suited to address this problem. And to date, we have built a distributed mobile application that essentially aggregates data from different sources. And what we want to do is take the next step and make this data accessible on a blockchain. And that's the reason why we are launching into our process of fundraising. We also have a pilot going on for members of a health club and employees of a hospital in North Carolina. And the early feedback we are getting is that once users aggregate their data, they want to do more things with it. And we believe that with our Health Wizz app, we envision a future where you'll never have to ever scramble for your health records again. Using our app, you'll be able to aggregate data from different sources, and then the app will organize it so it can be readily accessible using this new standard called FHIR. Your data will be with you wherever you go, as long as you have your phone with you. Now, this is a very unique EHR of one, because you have your clinical data as well as your genetic data with you all the time. And that has tremendous implications on medical research as well as personalized medicine. So how do we go from the EHR of one to a marketplace of health records? Well, once you collect your clinical data as well as your genetic data on your phone or on your private cloud, based on the pilot feedback that we are getting and from other sources, we realize that people want to do more with their data. They want to share it. Perhaps you want to share it with, with a medical research organization. Or maybe you want to share it with your data with a pharmaceutical company who is designing personalized medicine for you. Or maybe you just want to sell it your data, your medical data, to data brokers. Now, all these are smart contracts running on a blockchain. Oh, by the way, there is a multi-billion-dollar medical records data bazaar industry going on where they are selling our records without our knowing and without us getting anything out of it. But now, by digitizing these records and into assets and making them available on a blockchain, every time you share your record with another entity, you get rewarded with a digital token. And every time a transaction occurs, we take a small transaction fee, and that's our business model. We have had some early successes, as I mentioned, with the pilots. We are getting a lot of we are in the early stages, but we are getting a lot of good feedback from the members of the health club as well as from the employees of the hospital. We have demonstrated interoperability with Cerner and Epic, with the two major EHR vendors in the space. And we are also talking to Cerner for a partnership as well. And then we are also talking to some clinical research organizations because we think that this data that people are collecting could make them very active participants in clinical researches, studies. So besides the three co-founders, this is our team of developers and UI UX designers. We are based out of Washington, DC, and our app is currently available in beta state on App Store as well as on Google Play. Thank you.
So this is a massive opportunity. It's like identity, health records. This is like one of those big oceans to kind of boil in with blockchain tech. How do you start? Like, what's the initial utility of the app that kind of gets going here?
Yeah, so we recognize that, and what we have done is essentially, first step is to enable users to aggregate their medical records and organize them, and also get data from wearables. And what we are seeing is, and again, this is from the pilot, that people actually want to start playing with that data. Even before putting it on a blockchain, they want to start forming challenges and making it social so that, for validation purposes, they are using data from wearables to compete in challenges with their peers. We think that the employers would be interested in a wellness program as well. So you're right, and what we've done is first, focus on the content, and if the users aggregate the content, then there are lots of other adjacent markets that you can go to.
Your competitors out there, there's a massive amount of money that's gone into this space to fund, digital medical health records. And you go and you sell to a hospital, and you go maybe bite off one hospital, and your competitor goes and knocks down another hospital. So you've got all these kind of disparate silos of digitized records. Their business model is contingent upon getting network effects to hopefully have all the hospitals move to one of them, not the others. How do you get to even compete with that, or even theoretically get them to interoperate at a lower level when people are so entrenched on trying to be the digital record of choice for all the hospitals and push out the rest? Yeah,
so we are not focused. So this is where most of the money has been invested, billions of dollars, and everybody is chasing providers, everybody is chasing the EHR vendors, because that's where the money is. We are actually not even concerned, or I shouldn't say concerned, but we are not even talking to any of the hospitals or any of the providers. The reason is we are focused on the end user. The end user does have the right to get and aggregate all their medical records on the private cloud or on their phone. They own that data, they control it, they manage it. So that's where we are focusing on. Now, while all our competitors, like you said, are all focused on selling it to providers, selling it to hospitals, but that's a very different business model. We are focused on the consumers.
So how are you doing this aggregation specifically? Because that is that's a very hard problem, isn't it?
Yeah, so as I mentioned, there are two things. One is the regulation. The government mandates that all hospitals and all doctors' systems must make those records available to the user on the patient portal, and the user should be able to download that data, all the data from hospitals as well as doctors' offices. Now, what is happening is that only 40% of the people are even aware that this is available to them. And if they go on this patient portal once, only 10% of them come back. And that's because the patient portal that hospitals have and the doctor's offices have are very poorly designed. They are not user-friendly. But again, starting January 1st, 2018, they are asking the EHR vendors to implement APIs so that an app can talk to these systems. So that's how we'll leverage it.
Raj, I get your assertion that individuals want their health records, they want to manipulate it, they want to see it. Most individuals couldn't care less about blockchain. Why can't you do this as a centralized database, and why is it blockchain?
15 seconds.
So you're right. The users don't care about blockchain, but I think most of the people are lazy, and they are not going to do this unless there is an incentive to do this, right? And we think that the incentive is to cut out the middleman, the data brokers, and go sell this data directly to pharmaceutical companies and get rewarded for it. And that could change user behavior. On their own, you're right, the users are not going to do a whole lot. But if there is an incentive, then they might.
Thank you.
Thank you very much, Raj.
Thank you.
All right.